All right, yeah. Or it's having a conversation all month long. We've been learning more about your heart health. Joining me now is Dr. Sudhir Mungi from OSF St. Francis Medical Center. Dr. Mungi, we're talking about a fairly new technology or medical advancement that can help when people need a heart stent or open heart surgery. It's sort of an alternative. What is it called?
The procedure is called as Tavr, T-A-V-R. And what it is, the aortic valve is a valve which allows the flow of blood from heart to the rest of the body for vital organs. And as people age, with baby boomers, aging is a common issue, the valve gets narrowed, it gets calcified, and that's called as aortic stenosis. Now, about 500,000 population has severe aortic stenosis.
What are the symptoms of that?
So when the valve narrows, you imagine the blood cannot go out, so people can get short of breath easy, they can pass out, or they can even have angina or heart attack. And unfortunately, if they have any symptoms of severe aortic stenosis, the mortality is more than 50% in less than 2 years. I mean, I call it the worst cancer of heart, I mean, if you think about it. So,
but there is hope thanks to this new technology.
So, since 1960s, the gold standard has been an open heart surgery. And it's like if the door is not opening, you replace the door. And so all these years, people were getting an open heart surgical procedure for a new valve replacement. Tavr is a procedure where people who are high risk for an open heart surgery, which are many of our population who are in their 80s and even 90s, but who are still having a good quality of life, instead of going through an open heart surgery, we pass a valve which is mounted on a stent through a catheter from the groin.
Interesting.
So we pass it from the groin, and where the original valve is, that is smashed, and the new valve is put in with the stent. And
so there's no open heart surgery.
There is no open heart surgery.
It's through a catheter.
It's through a catheter, and now we don't even have to do a surgical cut down, as we call any opening of the skin. We actually pass sutures from outside.
Okay.
So,
how is the recovery time with something like that?
Well, so if I had to compare it to an open heart surgery, which may take about 6 to 8 days to be in the hospital, most of our patients should be sitting in chair after 4 hours of this procedure.
That's amazing.
And typically, we have actually beat the national benchmark because our patients, most of them, go home in 3 to 3.5 days. So it's just it's a milestone change.
All right, Dr. Mungi, we're running out of time here, but I do want to ask you one more thing.
Sure.
OSF St. Francis is coming up on a big milestone, you were telling me.
Yeah, we started this project in December of 2013, and this week we will actually do our 100th Tavr patients. And more important than that is, the quality of life that we are bringing into patients' life and their families' life. So I think this is a very exciting time for medicine in general in Central Peoria.
Very exciting. All right, well, thank you very much for coming in this morning. For more information on your heart health, please visit our website,